Shoulder joint. It is a joint between the head of humerus and glenoid cavity of the scapula. Type. Shoulder joint is a ball and socket type of synovial joint. Articular surfaces, head of humerus and glenoid cavity. And glenoid cavity is dependent by the fibrocartilaginous ring called glenoid labrum. Ligaments. The main one is the capsular ligament and also known as the joint capsule, and it is attached medially to the margins of the glenoid cavity beyond the glenoid labrum, laterally to anatomical neck of the humerus, except inferiorly where it extends downwards 1.5 cm more on the surgical neck of the humerus. Glenohumeral ligaments. There are three thickenings in the anterior part of the fibrous capsule to strengthen it. These are called superior, middle, and inferior glenohumeral ligaments. They are visible only to the inferior of the joint. Coracohumeral ligament. It is a strong band of fibrous tissue that passes from the base of the coracoid process to the anterior aspect of the greater tubercle of the humerus. Transverse humeral ligament. It bridges the bicipital groove between the greater tubercle and lesser tubercle. Accessory ligaments. Coracoacromial ligament. It extends between the coracoid and acromion process. Coracoacromial arch. It is formed by the coracoid process, acromion process, and coracoacromial ligament in between them. Bursa related to the shoulder joint. Subscapular bursa. It lies between the tendon of subscapularis and neck of the scapula and protects the tendon from friction against the neck. Subacromial bursa. It lies between the coracoacromial ligament and acromion process above and supraspinatus tendon and joint capsule below. It is also referred as subdeltoid bursa. Infraspinatus bursa. It lies between the tendon of infraspinatus and posterolateral aspect of the joint capsule. The bursa around the shoulder joint are clinically important as some of them communicate with synovial cavity of the joint. Consequently, opening a bursa may mean entering into the cavity of the joint. Relations of the shoulder joint. Anteriorly, it is related to the subscapularis, subscapular bursa, coracobrachialis, short head of biceps brachii, and deltoid. Posteriorly, it is related to infraspinatus, teres minor, and deltoid. And superiorly, it is related to coracoacromial arch, subacromial bursa, supraspinatus muscle, and deltoid muscle. And inferiorly, it is related to the long head of triceps, axillary nerve, and posterior circumflex humeral vessels. Arterial supply. It is mainly supplied by the anterior and posterior circumflex humeral arteries, suprascapular artery, subscapular artery. Nerve supply by axillary nerve, suprascapular nerve, and musculocutaneous nerve. Factors providing stability are the rotator cuff, musculotendinous cuff, coracoacromial arch, long head of biceps tendon, and glenoid labrum. And movements of the shoulder joint. The main movements are the flexion. It is provided by the pectoralis major and deltoid. Its range of motion is 90 degree. Extension deltoid and latissimus dorsi 45 degree. Abduction by deltoid and supraspinatus and its range of motion is 180 degree. Adduction by deltoid and pectoralis major muscle and its range of motion is 45 degree. Lateral rotation by deltoid 45 degree and medial rotation subscapularis and its range of motion is 55 degree. Clinical aspect. Dislocation of the shoulder joint often occur inferiorly and it is divided into anterior dislocation and posterior dislocation, and its main cause is excessive extension and lateral rotation. And clinical features are hollow contour in rounded shoulder and prominence of shoulder tip, frozen shoulder, and it is also known as adhesive capsulitis. It has pain with limitation of movements due to shrinkage of joint capsule, and it is an age phenomenon. Rotator cuff disorders, calcific supraspinatus tendinitis, and subacromial bursitis.